Okay, last one with this super trippy PowerPoint setup. Uh, Peripheral joint mobilization and manipulation. What does this mean for us? Let's take a look. Well, if I get this to come back. Oh, yeah, there we go. All right, so peripheral joint mobs. First and foremost, can PTAs do joint mobilizations in the state of Virginia? Yeah, you can. You can do grades 1, 2, 3, and 4. That's not always the case in every state, but here in Virginia we can, as long as we're supervised and directed by a PT. So, can all states do this? Nope. Nope. Some are different. You have to refer to the state practice acts to figure out exactly which state will allow you to do what in terms of mobilization. So there you go. What is a mobilization? Well, we're using joint mobs as manual therapy techniques to both modulate pain and also treat joint impairments that are limiting range of motion or affecting the mechanics of the joint, mostly like the inner articular mechanics of the joint. So the terms can be used interchangeably. However, when we say mobilization, we're usually talking about a less aggressive passive manual technique within our scope as LPTAs. And a manipulation is going to be more considered about in terms of like what you would think about a chiropractic manipulation would be. It's a high velocity thrust technique, or there's a high velocity thrust component to it. So they do say sort of like they're interchangeable, right? A mobilization can be considered a manipulation. You might hear it both ways. But the HVT, or the high velocity thrust technique, is the more aggressive. So the terminology to know is just resting position, right? Resting position is going to speak to the open pack position of that uh, joint. We can call it open pack position or the loose pack position, which means there's mobility with no tension, or there's minimum congruency between the joint surfaces, right? So it's the joint is in a rested position, and it's has full available, more or less, joint play or mobility with no tension on the internal structures. Joint play are the motions that occur between the joint surfaces and the distensibility, or the give within the capsule. So we've got movements that constitute joint play. This is going to have to do with your sort of arthrokinematics, right? The roll, the slide, the glide, the spin, what's happening between the joint surfaces, and how much give there is within that all encompassing joint capsule to allow for those movements to occur. So, a couple techniques we can use for terminology here. Distraction is going to be a separating or pulling apart of joint structures, right? We're just trying to pull one structure away from the other structure. Gliding would be considered a translatory movement where the joint surfaces are passively displaced parallel to the treatment plane, which sounds funny, but it's more or less a glide is just moving one surface on top of another surface in a gliding fashion across a parallel dividing line between the two. So we'll see some pictures of the treatment plane here. Oscillations, if you think of gliding to like rather than like rolling, sliding or gliding, it's kind of like you hit the brakes on your tires, you lock the tires, and they glide against, right? They have one surface that's fixed moving against another surface that's not. Oscillations are just normal non-axial movements at the end of passive range of motion. So they're just like little bounces, right? Just oscillations, just not really no axial component to it. They just we're going to bounce these movements. It's sort of a bouncing, almost like slightly circular to some degree movement. Here's our oscillations. I should have got a really good video on that. You can see that in your module. Grade 1 is going to show you it starts right at basically from the open pack position to the very beginning of the range, and we're going to contribute these small oscillations, small joint oscillations, little bounces right at the beginning of the range, right at the very beginning. That'd be grade 1. Grade 2 goes from essentially the open pack position or the loose pack position, and we increase sort of the not the intensity, but more or less the scope, right? We're going to increase the magnitude, is what I'm trying to say, of our oscillations. So we're going to do fewer but larger scale. We're going to amplify the oscillation, but take it pretty much and end it right at around the mid range. So instead of going for just the beginning, we're going now from the start all the way to the middle of the range with these larger scale, higher amplitude oscillations. Grade 3, very similar, except now we're going from the beginning or kind of like the middle of the range, depending, to the end range, all the way to the physiological end range of that joint play. In grade 4, we're going to go all the way to the end range as well, usually typically starting from the mid range. And then we're going to introduce these smaller oscillations, right? Smaller oscillations, smaller amplitude oscillations with higher frequency right at the end of the range, all the way up to the physiological end. Grade 5 would be a high velocity technique, and you can see here that we take up all the slack. There's no oscillation yet. We get it to the end of the physiological range, and then we introduce a high velocity thrust to take it beyond the available. That's your crack, right? That's the manipulation you think of with chiropractics. And then release, right? So that was a grade 5 mobilization or an HVT. We can't do those. All right, so here's a traction movement. This dotted line is the treatment plane, right? It's just a parallel line that's drawn between the surface of the fixed and the moving portion of the joint. Okay, so it changes obviously based on the direction that the moving portion is moving, right? So a straight parallel treatment plane would be something like this, and as I move this bone this way, the treatment plane starts to rotate in unison. Okay, same thing. There's your traction, right? In order to traction out here, I'd have to pull a different direction, right? Same thing with your gliding force. It's all going to be dependent on the treatment plane that you're working within. So if the the bones, the two bones, they're congruent, but you're changing the position of one bone, the treatment plane will change, and so the direction of your force when trying to implement your mobilization is going to change as well. So there's just another, sort of written out definition of the oscillation dosage and how you apply those rates of application for the mobilization. This is know the grades for sure. Understand basically the intended outcome, treatment outcome for implementing these grades. So if you're talking about 1 or 2, you're usually thinking of pain relief, right? That's essentially pain relief, right? To some degree, we're trying to get the joint moving, which should feel good. In certain components, we're acting on the gait control theory. Grade 3 is more to stretch the joint functions, so and increase the joint play. So like grade 3 and 4, and definitely 5, is to start to try and achieve a greater mobility and increase the joint play of the intra-articular structures that we're impacting. There's another diagram, just another way to see it. There's the HVT, right? We know we can't do these. That would be like your chiropractic manipulation. Yeah, nope, not for us. And how do we know if it's helpful, right? Well, first thing is like ask the patient, right? Ask and progress. Let's, assess the patient, figure out how they responded to the treatment, and then progress as needed. So if pain starts to decrease, or the pain with movement significantly improves, that's a good sign. You say, okay, this has worked. Assessment: has the range of motion improved? Have the joint structures loosened? Is there greater functionality? Is there greater functionality without pain? Those would be all good signs. What does the patient experience? Well, you can get some minor soreness, so you might want to cue that up for your patient. Say, hey, you might be a little sore after this, especially if you're working grades 3 or 4, and definitely 5. If their pain is lasting longer than 24 hours, you probably did too much. So the other side of that is, yeah, you could be a little sore, and that could be normal. But if you have pain that's longer than about a full day, we probably did a little bit too much in terms of our mobilization. We need to back it down, right? What was a grade 4 should probably now be a grade 3 or 2, maybe even 1 if they really, had a bad reaction. Or maybe we don't do it at all. All right. Constant range of motion and joint integrity assessment before and after and every time. So not always feasible in the clinic, but you would like to do it as much as possible to give you that close that feedback loop. That sounds a lot like vital signs, right? So that's how we're going to know if the range of motion is increasing or the integrities. We're going to sort of take a look at it before, we're going to take a look at it after, and we're going to take a look at it across the rehab timeline, right? Day to day, week to week, etc. And same thing with your vital signs, right? You should be having a healthy understanding of the inner workings of your patient's health and well-being systemically, even if that's not specifically what they were there for. Even if you're working with healthy populations that walk into your clinic, that are weekend warriors, right? Vital signs are going to give us important clues about just the general well-being of our patients, which we're advocates for as well, not just the rehab. Cool. So that is peripheral joint mobilization. I think if you really just have to do harp anything, know what an HVT is and that we can't do it, know the grades, know why we do certain grades, 3 or 4, 2, 1, know the dosages and the rates of applications, like how you implement each grade, how you grade each grade, what the treatment plane is, how we implement a distraction, a glide, an oscillation. What is the definition of joint play or resting position, open pack, loose pack position? Mobilization versus manipulation. Yeah, that's it. And just know that we can do MOBs, just not grade 5 MOBs. Cool. All right. So that's it for that one. Quick one. And that should take us through all our PowerPoints from week 3. Hope this has been helpful, and study hard.